Question number 4, Barbara Kuriger.
Thank you, Mr Speaker. My question is to the Minister of Health and asks, can he confirm that 551,000 patients received a first specialist assessment last year and that this is more than 1 in 10 New Zealanders?
The Honourable Dr Jonathan Coleman.
Mr Speaker, yes, and this is an extra 10,000 patients compared to last year. Overall, there's been an increase of 119,000 first specialist appointments per year, or 28% more than the 432,000 that were carried out in 2008-2009. The only answer to increasing demand is to do more, and this government is.
Mr Speaker.
Supplementary question, Barbara Kuriger.
To the Minister, what reports has he had on an increase in patients receiving elective surgery?
The Honourable Dr Jonathan Coleman.
Mr Speaker, the rise in first specialist appointments has been accompanied by an increase in the number of people receiving the elective surgery that they need. The number of patients receiving elective surgery increased from 118,000 in 2007-2008 to 172,000 in 2015-16. That's nearly 54,000 more surgeries per year than 8 years ago, a 45% increase.
Supplementary question, the Honourable Annette King.
How many patients did not get referred for a first specialist assessment because, as GPs have said, it's a waste of time, they won't be seen?
The Honourable Dr Jonathan Coleman.
We're collecting data on first specialist assessments. All we know for sure is that in the last quarter of 2015, 87% of people referred to GPs from GPs to the hospital got a hospital appointment. Another 8% was sent away because they were sent to the wrong clinic or there's wrong information. There was only 5% who didn't actually meet the threshold. But look, that figure will change a bit over time. But the point is, we're the first government to collect the data on access to hospital appointments. And that creates a picture which will enable us to do more. And as I've said in the primary answer, we are doing more and more appointments all the time.
Point of order.
My question is how many patients did not get referred for a first specialist appointment. He answered how many did.
No. The member, I think, didn't have the exact number. The Minister didn't have the exact number. I accept that, but he went through and gave a fairly detailed explanation and ended up with a percentage that he acknowledged may not have got their first assessment. I think that question was very, very definitely addressed.
Question.
The Honourable Annette King, supplementary question.
Will he now stop claiming that only 5% of patients are refused a first specialist assessment and sent back to their GP, which he said only a few weeks ago in this House, in light of the Ministry of Health stating they may climb between 10 and 15%?
The Honourable Dr
Once
Jonathan
again, the
Coleman.
member's making stuff up. I've always said that 5% would probably settle out at 10 to 15%. I said that in my opening statement when we first reported these results. So Annette King should just stop making stuff up. It's not good.
Mr Speaker.
Point of order.
This is where we get frustration, Mr Speaker, because I can quote from a question in the House and I could table his press release that has 10 to 15%. The Ministry said he claimed in this House only 5%.
Order. And I accept and can sense the frustration in the member, but equally I find it very frustrating when I was listening to the answer to try and ascertain what the Minister wasn't saying, and I couldn't hear the answer because of the level of interjection coming from the member's colleagues. Point of order.
Those interjections happen when the Minister is allowed to say that Annette King is making stuff up. It's that causes the disorder.
Order. No, well, the member is this time partially right, because the interjection certainly got louder with the last comment by the Minister, but the interjection started well before the Minister ended up with his final comments. Order. I am now going to ask for some cooperation from my left-hand side. If I continue to get interjection that is incessant, I will be asking a member to leave the chamber. Question number 5, Tracy.